Parkinson's disease is a neurological disease which occurs mainly in the elderly. This disease affects the central nervous system, which includes the brain, the spinal cord, and the nerves in the body. The brain develops a chemical called dopamine, which helps with movement, but Parkinson's disease does not allow the brain to create enough of this chemical.
This is the reason why symptoms of this disease primarily revolve around the movement of the body. In the earlier stages, it is hard to walk, turn, stand up, and sit down. As the disease progresses into the later stages, it is hard to complete simple commands. For example, making facial expressions while walking is sometimes challenging. They stop swinging their hands and they start shuffling before turning their own body instead of just turning their head. The main reason this disease endangers patients is because it makes it hard for them to swallow, cough properly, and breathe because they are too stiff.
As of today, scientists and researchers do not know what the specific primary cause of this disease is, but some contributing causes are known. You can get Parkinson's disease by suffering from head trauma, taking drugs for psychosis, or by having pesticide poisoning, among other causes. The lack of dopamine produced in an area of the brain called the substantia nigra, which is located in the mesencephalon, is also a contributing factor to acquiring Parkinson's disease. Similarly, an abundance of alpha-synuclein, a protein that releases neurotransmitters found in Lewy bodies, which are abnormalities in nerve cells, also contribute to the development of Parkinson's disease. Although it is uncommon, Parkinson's disease can also be genetic.
There are no known cure for the disease, but doctors have used drugs and surgeries to treat it. Drug therapy is very complex and many different combinations on drugs need to be given. The most efficient drug used is called levodopa, though there are many negative side effects to it such as hemorrhages, disturbances in heart rhythm, and confusion. Doctors have tried to surgically disable parts of the brain to lessen the symptoms of the disease. This method is still being studied by doctors today.
But the treatment will stop being effective eventually because the symptoms will get worse as time goes by. In the last stages, it is almost impossible to live independently, and some people completely lose their strength. The outcomes of this last stage might include difficulty sleeping, recurring nightmares, dementia, hallucinations, and or loss of contact with reality.
Though there is not much we can do to help those suffering with Parkinson's disease, we can always raise awareness and help fund research. If you want to learn more and help out, visit the National Parkinson's Foundation at www.parkinson.org.